Good morning, everyone, and welcome to the Health Committee meeting for Wednesday, June 15th, the most highly rated committee, by the way, on YouTube of any of the county committees. I will call the meeting to order at 9:30, and I will begin. As we gather this morning, I wish to acknowledge on behalf of committee and our community that we're meeting on traditional territory of the Algonquin Nation. We thank the Algonquin people and express our respect and support for their rich history. We are extremely grateful for their many and continuing displays of friendship. We also thank all the generations of people who have taken care of this land for millennia. With that, I would inquire, Ms. Hill, has the roll been called?
Yes, Mr. Chair, roll has been taken.
Thank you. I would invite at this point any disclosure of pecuniary interest, and if any, the general nature thereof. I see none. Can I have a motion, please, on the adoption of the committee meeting, the minutes of the committee meeting held May 11th, 2022? Moved by Councillor Grills, seconded by Councillor Doncaster. Committee, any errors or omissions? Seeing none, all in favor? That is carried. Thank you. Just before we get into the meat of today's agenda, I have had a request that at the end of the Emergency Services Department report, if we could advance the closed session so as to provide the paramedics the opportunity to tend to another commitment later on this morning. So, Mr. Morrow, I'm sure you've been paying close attention. Do we need to have a motion to amend the agenda, or can I simply by decree advance the closed session up to the Emergency Services report?
I think, Chair, I think it would be the preference to amend the agenda to make that particular change, sir.
Well done. You are never going to be caught out, Mr. Morrow. Can I have then, please, a motion to amend the agenda to advance the closed session? It has been moved by Warden Robinson, seconded by Councillor Murphy. Any discussion? All in favor? That is carried. Thank you. With that, we will go directly into the Emergency Services report. I would invite, at this point, Chief Nolan. You have the floor.
Yes, thank you, Mr. Chair, and through you to members of committee this morning. We have quite a big package, but a relatively short agenda to be able to walk you through the information within our report, starting with number one. And item number one is very similar to the last committee report we gave you, but it's a different subject. So again, Commander Amber Hultink, who leads our work in community paramedicine, has once again made a presentation and published her research in the advances in community paramedicine response to COVID-19. So that information was provided to the Canadian Paramedic Research Day, which was a virtual event held on May 26th. And Ms. Rebecca Illichik, Senior Communications Specialist at the Center for Aging and Brain Health Innovation, advised that a brief spotlight feature on community paramedic program would be included in its upcoming annual report to be published in July. So that information is provided in today's report, Mr. Chair, outlining the information that Amber has provided and that will be shared through the Aging and Brain Health Innovation group. So we're very pleased that that information is continuing to move forward and is really becoming a normalized practice, not only here in Renfrew County, but truly around the world, as we saw yesterday in number 2, Paramedic Research Day. So we had quite the outpouring of generosity from our sponsors in supporting the 3rd Annual Research Symposium, Pushing Evidence-Based Boundaries in Paramedicine, which was held in Burnstown on June 14th, 2022. With that, paramedic researchers and academics from around the world presented contemporary primary research in the field of paramedicine. This was an opportunity to showcase the advancements of the profession that was made through dedicated research and innovation. So we've provided the booklet and the outline of the speakers, and it was, I would say, an overwhelming success. It was also very nice, Mr. Chair, that we had the warden be able to spend the day with us yesterday, as we had Andrew Keck, Karen Simpson, and for a portion of the day, Jonathan Fitzsimon. And the reason that we invited those folks was twofold. One, we wanted to welcome them to the paramedic family and to be able to hear and share in the information that was being provided. And then secondly, we also provided commendation awards for their involvement throughout the pandemic and through the creation of VTAC in supporting paramedicine and paramedic practice in Canada. And it was very nice to have Debbie there. I'm going to tell a quick little story, Mr. Chair. I did just get back from Ireland, so it's always good to continue the tradition. And it was nice that Debbie came, gave opening remarks on behalf of County Council, but also educated people on VTAC. And it was very nice to have her there, and I'm sure she'll speak further to it. But afterwards, I know Debbie went for a show of hands to say, who knows about VTAC? And there was about 20 hands that went up out of the 120 people that showed up in the day. And if, as I fully expected, Debbie came away from the microphone and said to me, "Why doesn't anybody know about VTAC? What's going on here today?" And it was a beautiful moment, because really the crowd that we had there were truly international. We had paramedic chiefs, academics, researchers from around the world that were just learning about VTAC. So it was a great opportunity for her to share the experiences that we've had. But that all culminated really beautifully, because I think the conversations throughout the morning continued between the warden and the members. And I heard many times throughout the day, not only how great it was to have Debbie there and the warden there sharing her experiences and her support for the profession and her passion for all of that. But then the questions continued to flow about, what does VTAC represent? How do you work with primary care? What does it mean to the community? And it's been an exceptional experience, Mr. Chair, to be able to share those stories and have folks with us who can speak firsthand in terms of the impact to the community on behalf of County Council. So first, a big thank you to the warden for sharing her time with us. And being a big part of yesterday's celebration, which was the research day that we hosted at Calabogie. Paul was kind enough to come the evening before to the reception that we hosted at Calabogie. I'm sorry, yesterday was at Burnstown. But Mr. Chair, and I'm sure that I'm breaking a rule or two here, I would also like to acknowledge you and your incredible role as a steady hand in guiding our response to the pandemic as the chair of the Health Committee. As a curious and persistent member of the community who always forces us to strive for excellence in everything that we do. So I would like to present you with a Chief's commendation for your support of the profession, of the service, and of this committee and all of County Council for your role in supporting our pandemic efforts here in the County of Renfrew. So I'd like to hand this to you now if I could.
I'm all for breaking rules.
Let's break a rule together. How about that? All right. There you go. Thank you. All right. All right. Good. A little surprise for you.
Should do that more often. I'm speechless.
Thank you.
Agreed.
Thank you. That's an incredible honor. And getting back to the warden's question, though, how come more people didn't know about VTAC? I think it was a legitimate question. Anyway, thank you. Just before we get into much thanks, before we get into bylaws, I will review committee the information items, and I'll go back to information item number 1 on the Community Paramedic Program update. Item 2, the Paramedic Research Day. Warden Robinson.
Thank you very much, Chair. Yes, it absolutely was my pleasure to be there. Initially, I was invited to lunch, and then I saw what was on the agenda and wormed my way into the morning as well. But it was absolutely fantastic, and just, sitting and talking to some of the paramedics and the chief from Lanark, that was a very interesting experience as well. And having the opportunity, and it was a Coles Note version of VTAC. I will say that right up front because I knew they just didn't have the time for me to go on and on about it. But what I would say is that I'd be more than happy to be a guest speaker at the next symposium, wherever that is, Chief Nolan, to talk about VTAC. And that would be an absolute pleasure. And what is interesting, I did have to leave for the afternoon. I had 2 prior commitments, and in both of those locations, VTAC was mentioned, not to me. I eavesdrop quite a lot because, you know, it's my background in journalism. That's what you do. You get the dirt. But in both locations, there was someone who wasn't feeling well, and you know, people said, "Well, did you call VTAC?" Like, call VTAC. And it's just, it is out there and it is working. We just absolutely cannot lose this service. And I think we owe it to other counties and areas of certainly of the province of Ontario to advocate for VTAC to be duplicated in all those areas. We have an AMO Health Task Force meeting this afternoon, and I did ask that I am a member of the task force, but also I asked to be a delegation with Mr. Morrow. We will be talking about the OHT governance and structure, but we are also going to talk about human resources and healthcare, and in particular, physician shortage. And what I will be asking is for the task force AMO Health Task Force to push through to AMO that a provincial task force be stood up to look at physician recruitment and the lack of physicians across the province of Ontario. How we are doing things is not working. There has to be new ways of doing it, and I think that VTAC is one of those ways. And also, I'll do a little of a PSA for CBC Radio, Ontario, New Ontario Today, or I can't remember what it's called now. The topic is family physicians. So I will be tuning into that and try to control myself, but you may hear my voice on the phone. Just, you know, who knows. But anyway, thank you very much. And again, absolute pleasure. Congratulations on your award, Chair. Very much deserved.
Thank you, Warden Robinson. I certainly, I'll have to speak to that. I'm caught off guard. With respect to VTAC, absolutely, it has become, it's almost the activation code for you, Warden, that you are hearing that now, probably even in your sleep, that term, but it has become something that I think that our community thinks has been around forever. And I think that that's incredibly important to have established that groundswell, that foundation. But right from the get-go, it was always eminently clear this is something that is transportable. This can work more or less. And in fact, as we have found, I think once you get it in place, VTAC offers an enormous framework to be providing a lot of services. And as I've repeatedly said, I think we're only scratching the surface. So congratulations to the paramedic service on another very successful paramedic research day. The symposium, I think that this speaks volumes once again to the leading position that the County of Renfrew Paramedic Service has taken, not just in the province of Ontario, but I think in the country, even by dint of the fact of the international representation. We are clearly showing that, particularly as it pertains to the delivery of rural health care, the innovation that's being driven here, that challenge has been taken up incredibly by the paramedic service. So congratulations on a very successful symposium once again. Anything further? Seeing none, Chief, I will take it back to you for bylaws, please.
Great, thank you, Mr. Chair. And item number 3 within bylaws is related to the clinical assessment centers. And you may recall that at previous Health Committee meeting, we had a conversation regarding the support for the Connect Well community health program in Cobden, and we were previously working with Mr. John Jordan and his team there to support a new vision for Connect Well. So as not to confuse the two matters, we also requested space to be able to establish clinical assessment centers in communities throughout the county. And through those conversations, the Connect Well folks came forward and offered us space in Cobden, which is space that we've used off and on over the years for different purposes. But we will be establishing a clinical assessment center in Cobden, and geographically it's also a very central location, and I think serves a number of communities, particularly rural communities, but also is in many ways the hub of the spoke. I'm sure Councillor Murphy would disagree and say that that's Eganville, but we look forward to hearing from Eganville about clinical space as well, and continuing those conversations. So there is a document here that outlines the relationship between Renfrew County VTAC and Connect Well for the use of space for the remainder of this year, to be able to continue to evolve VTAC and its clinical assessment centers to support our community. So that's bylaw number 3. Would you like me to read the recommendation, Mr. Chair?
Please do, and then I will seek a mover and seconder.
And the recommendation that Health Committee recommends a bylaw be passed at the next session of County Council, authorizing the Warden and CAO to sign the lease agreement between the County of Renfrew and Connect Well Community Health to locate an RC VTAC, or Virtual Triage and Assessment Center, Clinical Assessment Center in Cobden, to expand services in eastern and western ends in the county. And I'll leave it there for you, Mr. Chair.
Thank you, Chief Nolan. Can I have a mover, please? Moved by Councillor Doncaster, seconded by Councillor Bennett. Discussion. Warden Robinson.
Thank you very much, Chair. I'm just wondering if the Chief can just walk me through the process and for someone who calls VTAC and how they are going to be linked to a actual clinic, your assessment center here. I know what we do now. I'm very clear on what we do now with VTAC. I'm wondering what that physical presence will actually mean to people calling in.
Chief Nolan.
Thank you, Mr. Chair. So the process and the synthesis of the clinical assessment centers is as follows. So if somebody has a reason for calling a virtual triage and assessment center, our VTAC model, they will call the 1-800 number, which is available on our website and billboards and electronic boards around the county, to be able to reconcile any issues that they may have related to episodic primary care needs within the community. Through that process, they are answered immediately by a medical receptionist who takes their basic health information and registers them, no different than should you walk into your own doctor's office. Through that process of registration, there's also an exploration in terms of what your needs are. We know that the medical receptionists have demonstrated exceptional ability at health system navigation and can support people to seek out alternate services without necessarily always requiring to speak with a primary care physician. So an example of that might be someone who requires a medication renewal, but has medication renewals already on file at their pharmacy. So they may be redirected to go to their pharmacist to make sure that in fact they've picked up their most recent medication, as opposed to seeing a family doctor to get a renewal for something they already have a renewal for. Or they require the support of public health, for example, for a well baby clinic. And those services are readily available within the community without necessarily needing to see a primary care physician. So there is a redirect at source for health system navigation to support people getting access to services that best align with their needs in the moment. Should you require, through the registration process, a follow-up phone call from a primary care physician, so let's say you have a change in your medical condition, or you do require a prescription renewal, or you need to see a specialist and you need a primary care physician to do an assessment and refer you to that specialist, those are the types of things that our primary care physicians through VTAC are able to do. They can also do a comprehensive evaluation, history taking, medication reconciliation, and so on over the phone. And if it's identified that you require a COVID test, then you can be directed to one of our clinical assessment centers to get your COVID test done. We now have ID Now machines, so we're no longer sending your samples away to Ottawa to the lab. We're able to do a very high level of evaluation with our ID Now machines using the paramedics at the clinical assessment centers to be able to get your results within 15 minutes. The reason that you'd be sent for one of those tests is because you meet one of the high-risk categories that have been defined by the province. So you're still calling VTAC, you're still being registered through our medical receptionists. You may still be meeting with one of the primary care physicians should you require that level of care or service through VTAC, and that is happening thousands of times a month across the county, meeting with the primary care physician. The primary care physician then is the one who directs you to a clinical assessment center, such as Cobden, as we're proposing in this draft lease agreement. And when you get to the assessment center, you'll be tested via our ID Now machines, should you have an issue that is COVID related. And you will also be further evaluated in terms of your history and your risk factors, and you will be physically assessed by the community paramedic or the paramedic at the clinical assessment center. We will then tie back, Madam Warden and Mr. Chair, through to the primary care physician through VTAC and confirm, based upon the results of your COVID test, whether you're eligible for antiviral medications. And if at that point you're eligible for the antiviral medications because you've spoken with the primary care physician, you've been referred to Cobden in this case, you've been assessed by the paramedics, you have a positive test result, you have the necessary comorbidities or risk factors associated with COVID, then you become eligible for antivirals. At that point, the paramedics can facilitate you receiving your antivirals. And of course, there are antivirals by mouth and there are also antivirals by IV. That primary care physician then determines which is most appropriate for you. And then we coordinate the administration of those medications with the patient. And then the community paramedics continue to follow them and report back to the primary care physician through VTAC in terms of your course of medication, as well as how you're doing in the following days and weeks. We will also put people on remote patient monitoring should their risk factors, let's say they have an underlying breathing problem or COPD, we can then provide them the devices and the follow-up using the community paramedics to ensure that their recovery is as expected. And in some cases, we've kept people on in the community paramedic program because they remain high risk, not only for COVID, but also for deterioration or instability within their condition. So really, the Clinical Assessment Center is a layer of service. I've just given you the thread, if you will, related to COVID cases. The Clinical Assessment Center, as we're currently using it and as we've been practicing in the past, will also see other people with risk factors that are not necessarily COVID related to ensure, Madam Chair, that they are receiving in-person physical assessments, history taking. In some cases, the paramedics are also doing point-of-care diagnostics and testing, so we can draw your blood for other reasons. We can do analysis with the machines that we have, the iStat machines that Council has supported to be a part of the community paramedic program. So really, you're getting a very wide range of services through the Clinical Assessment Center, but it is hand in glove with VTAC. It's a service of VTAC. It's not a separated service or concept. It's where the province is going towards having more of an urgent care access to primary care in Ontario. There have recently been conversations between the province and providers to say that they should only be COVID-related assessments occurring in these clinical assessment centers. But we have made clear that VTAC serves more than simply COVID. It's an essential service in terms of access to primary care within the County of Renfrew, especially given the number of unattached patients that we have in the County of Renfrew. And we're continuing to see both COVID and non-COVID patients, both through VTAC and our physician services, as well using the community paramedics and paramedics in the clinical assessment centers. And we are still doing home visits as well for patients who are bedbound or homebound or for whatever reason the physician and the paramedic agree, we will continue to provide home-based services that are more discreet, more appropriate, and also are less likely to cause a nosocomial infection or asking someone to go to a hospital or to another site and risk other infection for that individual. So I hope that answers your question, but those are the two primary threads that the CAC represents, and the relationship to VTAC and its overarching facilitation of all of this really important care.
Follow-up, Warden Robinson.
I just thank you very much, Chief. That was a very thorough answer. It was the last part was where I really was looking for the answer, but I'm thrilled that you took us from start to finish with VTAC, because again, at the end of the day, VTAC is the access point for people who need care and cannot access care. So thank you very much for that.
Thank you, Warden Robinson. I think perhaps Councillor Emo had a question, and then I will come to Councillor Murphy.
Yes, thank you. Very quickly, I note that County Council, or the Warden, has asked for a delegation at AMO to talk about VTAC, and so I'm very glad to see that, and I hope that the presentation will talk about this next iteration, or the natural advancement to the centers, and I'm just wondering if that's going to be the focus. Thank you.
Chief Nolan. Oh, yeah, I guess Chief Nolan or perhaps Warden Robinson.
Absolutely. We'll be talking about VTAC, the past, present, and the future is the plan.
Thank you. Councillor Murphy.
Thank you, Chair. Through you to Chief Nolan. Mike, ConnectWell, Bonnechere Valley is partners in ConnectWell. Is there an opportunity for us to host a clinic where our partnership is in Eganville?
Chief Nolan.
Yeah, thank you, Mr. Chair, and through you to Councillor Murphy. Absolutely, we welcome that opportunity. Really our goal is to get as diffuse a footprint as we can to make it as accessible to our communities as possible.
Thank you.
As a follow-up, yeah.
Councillor Murphy?
Thank you, yes. So if I who's administrating it? Is that through Brenda?
Thank you, through you, Mr. Chair. Both Brenda and Deputy Chief Grenier sitting behind you there. So he's probably the best one for you to connect with. And we'll look at the space as I provided the requirements at County Council previously, and go from there. So yeah, I would start with Matthew, and he can loop you in the conversations and look at the suitability of the space. Thank you.
Figuratively and literally, the paramedics are always standing or seated behind you. Yeah, and I just in the narrative presented here today, certainly I think the western portion of the county of Renfrew, I think that there still is, certainly the town of Eganville, village of Eganville is to the west, certainly of Cobden, but we have a pretty significant western part of Renfrew County that is still outstanding, and I'm sure that there are multiple efforts. My only comment really has to do with your comment, Chief Nolan, is that we just can't get that vestigial urge to silo these things, that you are still hearing, oh, but that's only for COVID, not for anything else. So as we are continuing, thankfully, to obliterate silos, that just constant urge to re-erect silos just can't seem to get away from that. Anyway, Councillor Doncaster.
Thank you, Mr. Chair. I just I'll take the opportunity to make a plug also that North Renfrew Family Health Team, in conjunction with the Deep River District Hospital, is building a new building currently. So I just wanted to point that out to Chief Nolan, that perhaps there may be an opportunity for some space in that new building. So.
Thank you, Councillor Doncaster. Anything further? All in favor? That is carried. Thank you. With that then, Chief Nolan, I will move you to item number 4, please.
Great. Thank you, Mr. Chair. And through you to members of committee, item number 4 looks shockingly like a previous conversation that we've had in these chambers and was previously approved. But there's been some changes to the intent of the agreement with the Pembroke Regional Hospital. So we've talked about originally, I think in January of last year, an agreement with the Pembroke Hospital to have paramedics assisting in triage and offload and working within the department. And then, as you may recall, there were some further questions that need to be resolved by Pembroke Regional Hospital and its employees about paramedics working in that space at 100% their cost, to be able to facilitate the flow of patients and to be able to provide care within the department. So subsequent to that, we used the original agreement with Pembroke Regional Hospital, which was never exercised as an option by Pembroke Hospital. We established the agreement, and then there was a hold put on that agreement at the time. We then were approached by the Empire Hospital, who asked us to do what we did with Pembroke on paper, but to be able to transact on that agreement and have paramedics supporting in the emergency department, and principally in the triage role in the department. So we use primary care paramedics and have continued to tweak that program, and have recently heard from our Empire that they'd like us to continue in that and continue until the end of their fiscal, so another March 31st, so that we have a longer window to be able to provide those services in support of their efforts. And I would say overall it's going very well. We've certainly learned a lot from a culture perspective, and Matthew has done an excellent job of navigating that relationship. But I think, it's now something that's become really a part of the team, and it's, I'm sure, assisted us in reducing offload delay as well as transfers to the city and so on. So it's really supporting us well. So this agreement that is really a revised agreement in number 4, I wanted to bring it forward to you because the material change in the agreement is that they are seeking advanced care paramedics to be working in the emergency department, shoulder to shoulder with the physicians and nurses in the department, which is different than the original conceived triage role with the Pembroke Regional Hospital. So I think that this is an important step. I think that the role and the scope of the paramedics working in the department, based upon their request, is well suited and will assist us in providing opportunities for paramedics in these roles at 100% the cost of PRH. It may also assist us in providing alternate employment opportunities for paramedics who may be on WSIB, for example, and create an opportunity for them to have some career progression, career laddering within their place of work. So we're pleased to do this. You may ask the question, why doesn't the hospital just hire paramedics? Well, in Ontario, only paramedic services can hire paramedics. And that's one of the important things that's included within the agreement. As well, you may say, do we have enough paramedics to do this? And in fact, these opportunities, we just, as we had recently posted the Empire experience, there was an outpouring of interest through the expression of interest in this role. And I believe in the Pembroke end, this is not only an important partnership, but an important opportunity for our staff who choose this path to have an alternative to doing the important work of 911 24 hours a day, 7 days a week, working overnight shift, for example, and being in the less controlled environment in the community and being in the controlled environment as part of a team within the hospital. So I'm very encouraged by this agreement. I'm very pleased that Pembroke Regional Hospital has reached out and asked us to work with them in this way. So from a liability and cost perspective, the agreement outlines the relationship, and the costs will be 100% assumed by the Pembroke Regional Hospital for these functions. You may also recall that paramedics have been working in the emergency department and throughout the hospital in the operating rooms and so on through their professional development opportunities. This is once again another opportunity to do that, but it's no longer at our cost. It would then be at their cost to continue this forward. So long gone are the days that Brian Leahy was the director of the emergency department over there and was our shadow paramedic in the department. I think we've lost that opportunity and that influence in the way that Brian was always able to bring a voice of paramedic perspective to conversations. I think this will assist in continuing that important relationship that Brian started many, many years ago. So the recommendation reads, Mr. Chair, that Health Committee recommend that a bylaw be passed at the next session of County Council authorizing the Warden and CAO to sign the agreement between the County of Renfrew and the Pembroke Regional Hospital for a partnership with the County of Renfrew Paramedic Service to include an advanced care paramedic in the emergency department. Mr. Chair.
Thank you very much, Chief Nolan. I would now seek a mover, please. Moved by Councillor Grills, seconded by Councillor Emo. Questions, comments? Once again, I think that this innovation has already been in place. If it didn't exist from the paramedics, someone would be proposing it. I think that it is the cross-pollination is vital towards recognize the system and not the individual components within. So commendations both to PRH and to the paramedic service, once again, moving the ball forward. Seeing nothing further, all in favor? That is carried. Thank you. That concludes the emergency services report. Could I have, please, a motion to accept the report as a whole? Moved by Warden Robinson, seconded by Councillor Bennett. Any further and final opportunity for question on any of the items on the emergency services report? Seeing none, all in favor? That is carried. With that, I will give opportunity for Ms. Poplinski. We will now immediately be going into closed session, so if you could be so kind as to suspend the live stream, and we will close the doors. We are back in open session. I want to welcome back anyone that is watching the live stream or maybe viewing this after the fact. But we are in open session, and now immediately upon going into open session, we are going to take a 5-minute break, bio break. So thank you for indulging, and we will see you shortly. With that, if you could count us out.
1.
Welcome back, everyone. That is the extended 5-minute break. So with no further ado, we will go directly to Director Mike Blackmore for the long-term care report. Mr. Blackmore, if you please.
Thank you, Chair Donahue, and good morning to you and committee. Through you to committee, the long-term care report begins on page 23 of your report. Item number 1 is the COVID-19 pandemic update. I'm very pleased to report that both Bon Manor and Miramichi Lodge remain free from any confirmed resident cases since May 9th for the Lodge and May 6th for Bon Manor. And since issuing the last long-term care report, this report rather, as has often been the case, we have another update coming. Received an update from the Chief Medical Officer of Health at Directive number 3. And you'll recall that Directive number 3 was essentially the document that outlined the various infection prevention and control measures that the homes are responsible to enforce. It has been revoked. And that may sound like big news, and it is, I guess, in as much as it's no longer a directive. However, the precautions that were in place pre-revocation of the directive remain in place. Only now they're under the document titled COVID-19. Sorry, the exact name here. The COVID-19 guidance document for long-term care. And essentially that's been in place since April 27th. So basically it's a status quo insofar as the precautions underway at both homes. So as such, we continue to rapid test daily. We continue to require mask use in the homes. We require to maintain our vaccination policy of 3 doses for essential caregivers, staff, volunteers, and 2 doses for general visitors. Item number 2 is the Fixing Long-Term Care Act, and as committee will recall, the act came into effect on April the 11th, 2022, replacing the 2007 Long-Term Care Homes Act. So while various regulations within the act are granted a delayed implementation, I mean, it's a rather onerous task to undertake, particularly given the circumstances that homes are faced right now with staffing challenges and what have you, and still maintaining the IPAC precautions. But Advantage Ontario, in recognition of this, did put forth a table for us, basically to a plan of attack to address those items that are coming up first in terms of what's due when. So the table is attached as appendix, long-term care LTC number 1. And one of the more significant undertakings will be that of putting together the revisions to the emergency plans that are now required. Of course, both homes have emergency plans, but there's been some additions with regard to content, how they're to be displayed on the website, and consultation. So that's a July 11th deadline for that one. So we're hard at work on that at present. Another one of the more immediate issues is that of implementing police checks. As you recall, last committee meeting we had that discussion with regard to the requirement for council as members of a board committee to have to undergo police checks and annual declarations, as it were. And I know that, as you recall, a resolution was passed that a letter be written by the warden to express to the province consideration of, well, reconsideration with regard to that undertaking, given it may well be a detriment for anyone to come forth and offer their services, and the fact that it's not a requirement for any other provincial municipal relationship insofar as any of their acts are concerned. And just further to that, the declaration. So, of course, as I mentioned, staff have to undergo declaration. So we may have staff that have been with us for 20 years plus. So They'll have to undergo a declaration with regard to any police check, conviction, charge, professional misconduct, what have you. So Advantage Ontario is working on a form, putting it through their legal, and we've having our legal take a look at it as well, with regard to a way to be able to present it to staff in such a way that is understood. And what remains to be seen is what the implications are for any potential positive findings that result. Item number 3 is the Bonnechere Manor air conditioning update. So the work on the project continues. This is through funds realized through the Investing in Canada Infrastructure Program. So we ran into some delays. We're expecting to be fully operational by June 22nd is the current deadline that we're working toward. Recognize that we have had some warm weather and some additional warm weather coming up. We've put into place some number of temporary measures with regard to setting up temporary AC units. We continue to monitor temperature and humidity throughout the home. And actually that's part of the new act as well, as it's beefed up that requirement to do so. Where Miramichi Lodge already meets the definition of what is considered air conditioning in resident rooms, which is one of the major factors. As I said, Bonnechere Manor should be there by June 22nd. But both homes do continue to monitor temperature, humidity manually at present, but we just engaged in an automated system called Blue Rover that will go about checking these temperatures throughout various places throughout both buildings. In the event we were to reach a threshold temperature humidity, a notice gets sent to the appropriate manager. Item number 4 is an announcement with regard to co-payment and preferred accommodations, just that the continued suspension of co-payment rate has been extended. As you'll recall, that was commenced July 1, 2019. Item number 5 is a butterfly update. So Ms. Cunningham and Ms. Sally Knocker from Meaningful Care Matters visited both Miramichi Lodge and Bonnechere Manor and conducted observational mornings, basically sat with the residents and managers on the units, just observing general interactions and, basically getting a snapshot of where we are now from where we were when the program is more active prior to being suspended with COVID. So we're reestablishing our baseline, and with that, we've keyed up some basically key items for education to take place with staff this coming fall. So yeah, that butterfly it's our first step to getting it back into on our radar and moving forward with that.
We'll just pause it similar to the emergency services report there. Thank you, Mr. Blackmore. We will take up resolutions after we return to the information items. I would seek now from committee any questions or comments on information item number 1, the COVID-19 pandemic update. I see at least the ink now has some opportunity to dry before we are changing this, even though there are constantly updates, and I'm quite convinced that there will be by the time this gets to County Council at the end of the month. We are at least in a more static period, which is reinforcing the emergence, perhaps, of the broader population moving out of a pandemic. With that, nothing further. Item number 2, the Fixing Long-Term Care Act 2021. I see none. Item 3, the Bonnechere Manor air conditioning update. And finally, item 4, item 4, co-payment and preferred accommodation. And now finally, item 5, the butterfly project update. Councillor Murphy.
Thank you, Mr. Chair. Not a question, just a comment to Mr. Blackmore. I'm very pleased that this is being renewed. I think it was a really great trip to Malton to see what they've done. And I know that Chair Donahue and I both attended, and we were really excited about bringing this back to the County of Renfrew. So I'm glad to see that this is being restarted. Thank you.
Through you, Chair, to Councillor Murphy, thank you. And just if I could add to, I think we'll be in a better place once things settle somewhat with COVID, and that with the recent funding for additional healthcare aid, PSW hours, we're in a better place to have that increased PSW to resident number, which was so important to pulling off the butterfly model. So, thank you.
Yeah, and thank you for that, Councillor Murphy. It seems like a lifetime ago, even though I think it was only 3 years ago this coming October when we made the trip to the Malton Village. Anything further on item 5? Seeing none, I'll yield the floor back to you, Mr. Blackmore, to take us through the resolutions, please.
Well, thank you, Chair Donahue. So number 6 is a resolution for Bonacher Manor Roofing. Shall I proceed with the background?
Yes, please, and then upon completion of that, if you could read the recommendation.
Okay. So background is the Bonacher Manor issued an RFT, request for tender, for a section of flat roof replacement. A mandatory site meeting was held on April 26th at 11 a.m. Proposals were received. 3 proposals were received that met all requirements. The project will require additional funds in the amount of $54,159.26 over and above the budgeted funds for the project in the approved 2022 Bonacher Manor minor capital budget. Procurement of the services included in this tender. It followed the requirements set out in Corporate Policy GA01, Procurement of Goods and Services Policy Section 19.7. Awards emanating from a request for tender that exceed $150,000 for the approval of County Council. And if I could, you could see that a number of options were presented in the RFT. The option that we're seeking is that, or maybe, shall I just read the recommendation at this point?
Please, yes.
Mike, could you speak up just a bit, please?
Sorry.
I think actually if you
Thank
just
you.
moved the microphone a little closer to you.
Okay, thank you.
Thank you.
A recommendation that the Health Committee recommend that County Council award the request for tender BM 2022-02 flat roof replacement project as per County of Renfrew GA01, Procurement of Goods and Services Policy Section 19.7 for a section of roofing at Bonacher Manor to Perth Roofing from Perth, Ontario for roof C, no taper, at the quoted price of $276,159.26 inclusive of HST, with $222,000 approved in the Bonacher Manor 2022 capital budget, and further that the shortfall in the amount of $54,159.26 be utilized from the Bonacher Manor unallocated reserves to finance the project above the original budget allocation, and further that the Finance and Administration Committee be so advised.
Thank you. Can I have a mover, please? Councillor Murphy, seconded. Councillor Bennett, questions, comments? Seeing none, all in favor? That is carried. Thank you. Moving on to item 7 then, please, Mr. Blackmore.
Thank you, Chair. Through you to committee, item 7 is the Bonacher Manor Courtyard Improvements Resolution. A recommendation that, background. Bonacher Manor issued a request for proposal for courtyard improvements, seeking quotes as lump sum costs, including HST, and is well priced individually, and as well to be individually priced per courtyard, and by turf replacement only. A mandatory site visit was held May 19th, 2022 at 11 a.m. and proposals were received until 2 p.m. on June 1st, 2022. One RFP was received, meeting all requirements from Country Caretakers, Renfrew, Ontario, listing a complete price of $634,608, including HST. Country Caretakers provide a fee breakdown as requested within the RFP as follows. And there's a table presented listing options for HM1 North, HM1 South, Pinnacle North, Pinnacle South, for both complete courtyard price and turf-only replacement price. With the complete project fee submitted being over the budgeted amount, staff is requesting that Pinnacle South courtyard be completed inclusive of turf replacement and concrete work necessary for courtyard refurbishment, and that only turf replacement be completed for the 3 remaining courtyards, allowing for further funding of this project in future years. Procurement of services included in this tender follow the requirements set out in policy GA01, procurement of goods and services policy section 19.7. Awards emanating from a request for tender that exceed $150,000 for the approval of County Council. The recommendation that the Health Committee recommend that County Council award the request for proposal to Country Caretakers, Renfrew, Ontario, as per the County of Renfrew GA01 procurement of goods and services policy section 19.7 for the Pinnacle South courtyard, completed inclusive of turf replacement and concrete work, and HM1 North, HM1 South, and Pinnacle North courtyards turf replacement only for a price of $360,114 inclusive of HST, which was approved through the Bonacieux Manor 2022 capital budget, and further that the Finance and Administration Committee be so advised.
Thank you once again, Mr. Blackmore. Once again, committee, could I have a mover, please? Moved by Councillor Emo, seconded by Councillor Grills. Any discussion, comment? Warden Robinson, please.
Thank you very much, Chair, and through you to Mr. Blackmore. When you say completed courtyard, what does that entail?
Mr. Blackmore, please.
Through you, Chair, to the Warden. Completed is any necessary concrete work, structural work aside from the turf itself, whereas the other courtyards at this time is just replacement of the turf.
Follow up, Warden Robinson.
Yes, thank you, Chair. So when I was at the Volunteer Appreciation Afternoon, which was absolutely fantastic, I did have a couple of volunteers coming up and asking me about the actual landscaping of the area. So I'm not sure which one, and that's my ignorance, which courtyard is Pinnacle South. Is that the front entrance or not?
Mr. Blackmore, please.
The front entrance, that's separate. It's not one of the courtyards. The front entrance, and if I could, Chair, through to the Warden, since your visit, the work has commenced there, and I did receive an explanation from the groundskeepers with regard to why the annuals weren't in just yet, and it was a matter of recommendation that it was a bit early to put them in for fear of damaging them from frost, I suppose, was the reasoning. And the greater majority of the flowers put in the front bed were annual, so they're in place now. They look good.
Thank you. And final question, Warden Robinson.
I heard that. I'll use that word. I'm glad to hear that because, you know what, it was a wonderful afternoon. Everybody was having a good time, but you have to love it when family members or volunteers continue to advocate for the residents and for the home. And they wanted something bright. They wanted flowers. And they actually, I asked them to send me an email, and they sent me an email as well with pictures about what they would like to see happening. So I'm really glad, and I will certainly respond to them, letting them know that you were more than aware of the situation and that has been rectified. So thank you very much, Mr. Blackmore.
Through your Chair, to the Warden, thank you.
Thank you, Warden Robinson, and I think that those of us that have spent a lifetime in Canada, just like annuals and perennials, we do blossom when the weather turns warmer. So I think it is certainly understandable why those comments are being received. Anything further on the work at the Manor? Seeing none, I'll call the question. All in favor? That is carried. Thank you. And Mr. Blackmore, on to the 8th and final item, please.
Number 8 is a resolution to extend the long-term care homes COVID-19 vaccination policy. Just if I could, as was pointed out earlier in the report, while Directive number 3 was lifted, the COVID-19 guidance document that is in place still maintains all of the IPAP precautions that were underway even months ago. They continue. So with that, if I could, the background, committee will recall that the presentation of the long-term care homes vaccination policy at the Special Health Committee meeting held on March 28th, 2022, and the update provided at the May 11th, 2022 Health Committee meeting. Staff is recommending that the long-term care homes vaccination policy attached as Appendix LTC-2 remain valid until committee reconvenes in August 2022 in consideration of the prevalence of Omicron variant and risks posed to vulnerable populations. If I could just, like I mentioned earlier, that we'd signed on to the Advantage Ontario COVID coalition, the vaccination coalition, and we have seen, we continue to see staff still testing positive, and we're still going on the guidance provided within the guidance document that there's a lesser of a chance with regard to people becoming ill or presenting or passing on COVID-19 with full vaccination, and given that we are caring for the most vulnerable in our population, that we see it prudent to continue on at this time till August.
Thank you, Mr. Blackmore. If I could prevail upon you to read the recommendation, please.
The recommendation of that, the Health Committee recommends to County Council that policy G010, vaccination policy for the long-term care homes, remain applicable.
Thank you. Can I have a mover, please? Councillor Grills, seconded by Councillor Murphy. Discussion. Seeing none, all in favor? That is carried. Thank you. With that, we have concluded the long-term care report. I would seek now a motion to approve the long-term care report as presented. Councillor Bennett, seconded by Councillor Emo. Further and final opportunity for a question on any component thereof. Seeing none, all in favor? That is carried. Thank you. The final item on today's agenda is the Board of Health minutes for April 26, 2022. I would seek a motion, I think Ms. Hill has the specific wording, but essentially to receive or accept the April 26th, 2022 minutes of the RCDHU Board of Health. Councillor Doncaster, seconded by Councillor Murphy. Any question or comment? I see none. All in favor? That is carried. Thank you. We have advanced the, there is new business. Just about jumped over it. Any new business this morning? Councillor Murphy.
Thank you, Mr. Chair. The warden and I received an email this morning from Gerald Tracy letting us know that the ambassador for the Ukraine will be at the event on Friday evening, and he was hoping that in a show of solidarity, if we could wear blue and yellow or blue or yellow. So thank you, Mr. Chair.
Thank you. And just for clarity, that is the fundraising initiative spearheaded by Mr. Tracy with respect to the tragedy unfolding before our eyes in Ukraine. And this is a fundraising initiative, so it is as it pertains to that. So thank you for bringing that forward, Councillor Murphy. Any further new business? I see none. We have advanced the closed meeting. We have dealt with that item of business. The date of the next meeting is Wednesday, August 10th, 2022. I would seek a motion to adjourn. Just before that, I wish everyone an outstanding summer. Hopefully we return to a typical summer or as close to it as is feasible. In any event, I would invite the motion to adjourn, please. Councillor Bennett, seconded by Councillor Grills. All in favor? That is carried. We are adjourned.